Hi, I'm Frida Martin, and this is my combined health systems presentation. Health systems have developed in unique manners across the globe. Each health system has its own unique traits, strengths, and weaknesses. In this PowerPoint, I will be discussing the strengths from various systems around the world and how those strengths could be combined into an optimized health system. It is no secret that the United States has some serious shortcomings in its healthcare system, often being cited as having the worst system among OECD countries despite spending the highest percent of its GDP on healthcare. One thing it does well with, however, is preventative care. On average, developed countries spend about $100 per person on preventative care. The US spends a whopping $250, 2.5 times as much as the average. This can be partially attributed to the sheer amount of money the country spends on healthcare overall, but even within the country's spending, preventative care receives the most money out of all healthcare needs except for cardiac and circulatory care. Unlike in the overall system, the amount of money going into preventative care shows, too. In the UK, 63% of women are screened for cervical cancer. This percent goes up to 64% in Denmark and is only 49% in the Netherlands. In the US, 80%, or 4 out of 5, women are screened for cervical cancer. Breast cancer screening is also far more widely practiced in the United States than in Germany, Norway, or Switzerland. American children also have a higher chance of getting the measles vaccination than in France or Canada, for example. The level of preventative care focus in the United States is great, but one of the issues with the U.S. health system is the inefficient health spending. To counteract this, an optimized health system would also have to utilize methods of maximizing output per dollar spent on healthcare. Germany's healthcare system is quite effective at this. In Germany, hospitals receive a yearly budget as negotiated with the National Sickness Fund. This budget is where the doctors in the hospitals receive their salary from. Unlike with a highly privatized system paying doctors for each service performed, Germany's doctors receive a quarterly cap. They're paid for each service they perform as well, but once they have reached the maximum amount of money allotted to them for that quarter, they will not be paid any further, regardless of the services they provide. This method has been known to frustrate the doctors themselves, but the results are very apparent. Prescriptions, MRI services, and even surgeries are much cheaper as a result. The budgeting is also reflected in total spending on healthcare in the country, which spends about half as much per person as the United States. One facet of a healthcare system that must be present to consider it optimal is the ability to improve. No matter how well a healthcare system is designed, there will always be new technology, emerging health issues, and more research uncovering new information. This is why it is integral that a healthcare system can innovate and integrate. Rwanda's healthcare system has this trait in spades. Part of having a lot of innovation in a system is encouraging that innovation. Rwanda does this by incorporating quality into pay, i.e., more funding will go to care providers that are providing higher quality care. This encourages innovation because to find new, better ways to provide care will translate to receiving more pay. Rwanda is able to get new innovations off the ground by making the innovation comprehensive. Rather than just creating a new technology or a new service, they have adopted the strategy of recreating entire processes to maximize their efficacy. For example, vision issues are treated with highly trained ophthalmic experts, high-cost equipment, and complex technical eyewear inventories, as according to James Chen, founder of Clearly, in OECD countries like England and the US. This is not utilizable in most of Africa, where many of the countries are still developing. Instead of all this, Rwandan innovators have rolled out a 3-day training course to give local health workers the information and skills needed to give eye screenings and make referrals. This reduces burden massively, which makes sense when considering that 80% of untreated vision issues globally could be solved with just a pair of glasses. Clearly, it is a good thing for a health system to value preventative care, innovation, and effective spending, but if the public cannot access that system, what good does it do? Therefore, the optimal healthcare system is also universally accessible. There are several countries that utilize universal health systems, but one of particular note is Mexico. One thing about the Mexican universal care system that is quite impressive is that it was implemented and was covering all citizens in less than a decade. In 2003, reforms to the health legislation were approved, leading to the system of social protection of health reforms. This allowed for the creation and implementation of Seguro Popular, which is a program funded by the government that ensures adequate health coverage for all Mexican citizens, regardless of income. Over 50 million citizens who were previously without health insurance but are now, over 50 million citizens were previously without health insurance but are now covered by Seguro Popular. This will be an important facet of the optimized health system so that it can service as many people as possible. Even with a strong health system design that incorporates all of the aforementioned traits, an unexpected health crisis could throw everything out of whack. With this in mind, it is clear that an optimal health system will also have strong crisis responsibilities. South Korea has demonstrated this trait very well in responding to the COVID-19 pandemic. For some time, when the virus was just beginning to spread to a wide variety of countries, South Korea appeared to be quickly losing control of community spread. It had the highest case count outside of China, and hundreds of members of a church where a massive outbreak began were unable to be tracked down for testing. All of this makes it all the more impressive that as of the beginning of May, they barely had 10,000 cases, and were beginning to see 0 new locally transmitted cases on some days, all despite not having imposed a lockdown. This impressive feat is due to several traits that were present in the crisis response efforts of the country's health system. The first of these is that the response was prompt. Almost immediately upon the recognition that an outbreak was occurring, widespread testing and quarantining of individuals who may have been exposed began. Furthermore, the response was robust. Drive-through clinics increased in use, telehealth apps began to be utilized, instant testing kits were developed, and a brand new health facility known as a Life Treatment Center was even innovated just for isolating and caring for mildly sick COVID-19 patients. Lastly, the response was effective, and what this means for crisis response is really case by case, but at the heart of this trait is that appropriate criteria for shutting down a crisis are met. In the event that the crisis is a communicable disease outbreak like in this one, that means things like testing working properly, but also very important is public compliance to social distancing and source control. Incorporating this into an optimized health system will help it to withstand unexpected public events, and in particular, it will give the optimized health system a way to respond to the COVID-19 pandemic. So in summary, the optimized health system will cover the entire population. It will value innovation and use things like funding to encourage that. It will also emphasize preventative care with the knowledge that an ounce of prevention is a pound of cure in mind. It will spend money strategically to avoid unnecessary spending on the system. And it will be capable of reacting to public health crises such as the current pandemic by making responses prompt, robust, and effective. Thank you for watching. And here are the sources I used for this presentation.